Good evening. My name is Lynn Woodall, and I have chosen to discuss the ethics involved in the case of Helga Wangley and futile treatment. This case was in Minnesota, and it's important to note that it was also in 1989, when ethical cases might have been handled differently than they are now. This case began when Helena, an 86-year-old female, fell and broke her hip. After successful repair of her hip, she was sent home and then within 3 weeks developed respiratory distress and was taken back to the hospital. This was in early 1990. She then required a lengthy inpatient stay and was intubated due to the respiratory distress. She was awake and alert and able to communicate with family, but after a transfer to an inpatient rehab, she went into cardiac arrest. They took her back to a different hospital and was found to be in a vegetative state with little chance of recovery. Her family disliked this decision and asked that she be transferred back to the original hospital where they felt the care was better. With an accepting physician, she was taken back to that hospital, and after 5 months of ventilator care and several physicians expressing that continued care was likely futile and wanted to stop the care and allow the patients to pass peacefully, the patient's case was taken to court. The family declined to acknowledge that the patient was in a persistent vegetative state and suggested that withdrawal of life-sustaining technologies reflected a moral decay on our current culture and hoped instead for a miracle. The patient's husband said that only God can take life and that doctors should not play God. The treatment continued until early 1991 when the hospital took the case again back to court. They stated that they felt that medical professionals were being obligated to provide what they considered to be unbeneficial and inappropriate treatment. The court ruled in favor of the husband and the family's wishes, and the care continued. The hospital was unable to wean her from the ventilator, and in May of 1991, she was transferred to a facility that specializes in the care of respiratory patients and respirator-dependent patients. She then experienced a cardiopulmonary arrest at this facility and passed away. I feel that the futile treatment of Helga was against the ethical principle of non-malfeasance, which is the obligation of a provider not to harm the patient. It's also called do no harm. This principle supports several moral rules, such as do not kill, do not cause pain and suffering, do not incapacitate, and do not deprive others of a good life. I feel that the principle was violated because keeping Helga alive in a vegetative state did not provide any good quality of life for her. She was not able to give consent and did not give permission to be kept in this state. The fact that her family suggested that providers were playing God by wanting to remove life support directly supports, in my opinion, the opposite fact that the family were actually the ones trying to keep her alive by artificial means. The other side of this case is that courts must acknowledge that due to previous cases that were seen through courts of law, that they are aware that medical professionals, though trusted as the knowledge of all medical practice, still have to allow the patient and families to be autonomous in their own decision-making. This was supported in an article about the limits of a wish, which points out that although the patient and family have listed certain wishes for themselves for end-of-life care, this may not always represent the best ethical outcome when it comes time. There are also legal limits to state authority that apply to this case. The state has constitutional authority in limited capacities to mandate that physicians provide diagnostic tests, treatment, and treatments that do not align with professionally created practices and morals. Though Helga's family asserts that her alleged desire for continued biological existed, that this alone cannot compel medical providers to offer care on a long-term basis that is professionally recognized to carry no therapeutic benefit. Medical ethicists who consider the possibility that rarely irreversibly comatose patients have regained consciousness have offered further arguments for maintaining such patients on life support long-term, even if the result can maim or harm the person if they do survive. Their argument is that many blind, mute, and paralyzed people can still claim that their lives are worth living. and this assumption that disability is a worse fate than death seems highly questionable to them. I think that with all things considered, on a case-by-case basis, the lessons learned from those who have been in this position and share the same outcome in the end, we can safely assume that futile care should always be questioned, and then arrive to the personal conclusion that you could empathize with. If you were in a persistent vegetative state on a ventilator, would you want to keep your body alive only to experience cardiac arrest or eventual death? Thank you for listening.